Hello, I'm a past patient of Dr. Dorito. He did surgery on me a little over 5 years ago for a really bad case of acid reflux disease. He repaired a hernia and did a fundoplication. Uh, I was in very bad shape. I was so bad off that I was taking really, really high doses, higher than normal doses, twice a day, proton pump inhibitors. The things you see in the pharmacy, you see these pills in the pharmacy, there's a lot of them. Uh, Even with the pills, I did still had a lot of pain. In any case, I had some lab work done, and based on a gastroscopy and an analysis of the tissue samples from the esophagus, I had low grade dysplasia. And what happens is that the esophagus is not made for acid. It doesn't. It's not acid resistant like the stomach is. And so the acid starts out causing a lot of inflammation. Then it turns into something that's called metaplasia, where you have this abnormal cell structure. Then, if continues to progress, the metaplasia can turn into low grade dysplasia, and the low grade dysplasia can continue to progress to high grade dysplasia, and it goes from high grade dysplasia on up to cancer. In which case, it's not a good thing. The outcomes are not really good for esophageal cancer. In any case, I didn't want to get cancer. I didn't want to suffer anymore. So I went in and one night, and I was gone. I was cured. He just, this procedure on me I was fairly painful. When I left without pain, uh, I refused all pain medication in the hospital for the one night that I was there. And but the most important thing I'm saying about this video was that post 5 years after the surgery, I don't have low grade dysplasia anymore. I had dysplasia before, and so what can happen? There's no guarantee it'll happen, but it's generally what can happen is that when you get to surgery and you stop the acid damage, then you can stop the progression going towards cancer. In my case, that worked very well. And because you remove the acid, you remove the causative factor. And so, in some cases, even that I read and hear that dysplasia actually goes backwards, or if you have metaplasia, it could revert back to normal tissue. And some people, they're completely back to what they were before they had even acid and problems. So, but the main thing is that I had 2 years in a row, two consecutive tests where the low grade dysplasia was gone. Okay, and the metaplasia appeared to be recessing, going backwards, getting smaller. The part that I had of the esophagus where there was metaplasia. So the moral of the story is that it's important to think about not only the acid pain, but it's also important to think about the damage that it could do to your tissues and how it could actually progress into cancer. I was in a doctor's office renewing a prescription for allergy medicine or something, and the nurse that I spoke to, she said, "Have you had any surgery?" I said, "Yeah, I had a surgery for the fundoplication." She said, "Oh," she said, "Her father wanted to have that surgery, but he waited too long and he couldn't have the surgery. They just wouldn't do it for whatever reason uh, because it already progressed to cancer." And this what could happen is that you don't even have to feel what's happening. It can happen over who knows what length of time, sometimes faster, sometimes longer, sometimes many years. But the important point is it's that progression you don't want, and you don't want to have to worry about getting into cancer. So does this mean you need a surgery? Absolutely not. It doesn't mean you need a surgery. It simply means you need, if you have a problem, you need a consultation with Dr. Dorito to tell you or evaluate what he thinks you should have. Uh, in some cases, surgery is not, in many cases, actually, surgery is not necessary. But when it is, you got the best guy to do it. And why is he the best guy? He's one of the very, very, very few people anywhere that's all they do is all day long, day out reflux surgery. He's done over 1,000 of them, and he does them regularly. And the outcomes, if you look on the website of his, the Google star reviews, it's almost wow. He cured me. I'm cured. I'm better. A miracle. Case after case, some people suffered 10, 15, 20 years with reflux and suffering with a lot of pain. And just one night, and it was cured. And it happens to be one of the safest procedures there is. It's not something that's a high risk procedure. Of course, the risk depends on your situation, and that's part of your evaluation to determine these type of things. And so, I would just encourage you to get an evaluation.